Excuse me. What do you think of the vaccine shortage in Pennsylvania? Hmm. Are you both in category 1A? I think you guys all qualify. You're seniors. You're definitely all seniors. What do you think, ma'am? Will you be getting the vaccine when it's available? I know you qualify, but there's a shortage right now. How do you feel about that? What? All right. Well, here, I can give you a website tour later. What do you think? Would that be helpful?
Very important. Chilling the out. Oh, man. So this week in Pandemic Land, as we've decided to call my segment, this week in Pandemic Land, Charmaine smokes pot. If you're new to the show, I don't smoke cigarettes. I smoke weed. Much better. All right, the numbers. As of Tuesday, February 2nd, 2021, that is today. This will air tomorrow, Wednesday. According to the Worldometer website, we have 69,837 total cases, 300 new cases having been added overnight. 1,536 total deaths, 15 of those having been new within the last 24 hours. If I remember correctly, it was 1,270 last week. So that's, we're up another significant number of people. I mean, it's like another 250,000 people. All right. Well, last week, so we talked a little bit about vaccines, and a viewer brought up a very important point, and I can't believe I forgot to address this, but that is that potential long-term side effects of the vaccines are kind of not known since we haven't hit that long-term point yet. Like superpowers would be cool. Will I glow? But will I glow and have cancer? I like to ask questions. It's some information, but the information always begets more and more and more questions. And as I said last week, I have at least a year, as it is looking like now to even decide if I want to get vaccinated or not. I'm definitely in the phase 2 category, and I'm okay with it. Like anybody in any of those other categories, I would get behind them in line, at any time. So that's fine. And that kind of gives me a year to see how other people do with it and to do my homework, which I've been a little bit lax on. But I have a bunch of questions now. So I wind up with new questions every week, which is cool. So now we're caught up from last week, talking about the vaccine. Some vaccine information for Alleghenians, as I'm dubbing the lot of you. There's a website. I will drop that in the info. It's https://coronavirus.health.pa.gov/topics/vaccine/vaccine.aspx. But again, I will put the link in the bio. That was just fun to say. If you have questions on the vaccination process, call 1-877-724-3258. This number is also on the website. It's like on page 1. And we're going to take a look at the website here.
But I'm checking out the PA vaccination website. It's everything's really easily labeled. It's kind of cut and dry where to go if you have questions about certain things. Colorful, I like that. It's pretty. The icons are good. They're very clear. The information is presented in a nice, concise way. It's nice that they pretend that they at least have a plan. They're like, we're trying. Yeah, right now they're doing the Moderna and the Pfizer vaccines with a few other ones still in clinical trials and not ready to do their thing yet. And then what is this? Be safe. Oh yeah, this is a good time. Be safe. Be safe, everybody. Oh, here's all the phases. This one's optional, by the way. I haven't found a single thing about it being mandatory yet. So there's that. I'm in phase 2, but that's okay because I would stand in line behind any of those other people any day of the week. I'm punching in my zip code here to check out where the locations near me are. And there's a whole bunch. Check that out. It's pretty easy to access if you ask me. Again, ta-da, try to have a plan. So, okay. Yeah, some stuff to help you get prepared. Looks like there's a form to fill out. Are we surprised? Other resources. Cool. And then the FAQs, the facts. Just the facts. I love these. I had a field day here. What does limited supply mean? It means that there is not enough vaccine for the entire population of Pennsylvania. So they do address this. They means that not everybody will be vaccinated right away. Understandable how concerning this would be. So basically, they acknowledge that this is a thing. Will the vaccine be mandatory? No. Cool. And they address this again, if I recall correctly. Oh, by the way, look up the Metcalf Minute. Does PA have plans to join a group to review the vaccine safety? No. Dr. Rachel Levine, Governor Tom Wolf, trust the CDC and the U.S. Food and Drug Administration, yada, yada. PA considering any scenarios where the vaccine would be mandated, e.g. working in congregate settings. We have no plans to make the vaccine mandatory. This is of much interest to me. How many trials were completed and how successful were they? What side effects came out? Currently, clinical trials are evaluating the investigational COVID-19 vaccines in many thousands of studies to generate scientific data. Department and License of Vaccines to Prevent COVID-19 Guidance Department. So they give you the guidelines under which they're being studied, which is cool. That would be a good thing to check out, I think. Probably answer a lot of questions. What will the vaccine mean for Pennsylvanians and how will their lives be impacted? And if I recall correctly, we're still going to have to keep going with the protocol for a hot minute. Everything that's in place.
Doing things on the internet. I find it very intriguing that we're getting used to going places online. It's a level of abstract thinking that like it's just neat to see people adapt and react to, and it's been interesting for me too, like, watching a concert in my living room. Anyway, I can't remember if I played this song for you guys yet. I'm gonna have to turn this off. I love you. I'll talk to you later. This is actually Victory. Like, sorry, boss, I'm filming. Sorry, I can't remember if I played this song for you guys or not yet, but considering that Monday this week was the 11th anniversary of my youngest brother's suicide, and I wrote this song about some of those feelings that have come with that event in my life, it just sort of happened this year. Felt good to write it. Some songs really get the right things out, and it feels good to let them go into something else. And I've decided that it is going on my band Dichro's upcoming first album. The working title of that is Love Letters to Fascists and Other Ideas. We have some interesting music on there. And we've been working on videos, and I'll pop a link to the band page in the info as well. We're on the YouTubes. So there's that. And I do wish, I wish this about so many songs I've written, and I'm sure other artists share this. I wish that his story didn't still feel relevant, but considering that he was so isolated and alone and homeschooled, like a lot of kids are, and in a situation where it was hard for him to get what he needed in terms of coaching, and there were a lot of other factors in there, depression, bullying. I just feel that there's probably other kids out there that were suffering like he did. And he took his life at such a young age. It seems just too young to make a decision like that for yourself. Too young to have evaluated everything. So on that, I was so happy to talk to some parents about that situation and their own situations, and to see and hear stories of people doing what they needed to do and being there for their kids. Is really sweet. Speaking of children, speaking of children, it's important, right? Right, Cooper? Very important. So anyway, this song was also released on the MK Ultrasound Podcast, which I'll drop a link to in the info also. And something else I read recently that really stuck with me is I would rather read or listen to your story, or what's on your mind, or what's troubling you, or what's making you feel like you just want to give up, than read your obituary. And that is true for every single person that I know, and everybody that I don't know. All right. This song's called Nothing's Funny. We wanted hard, but we got shame. Let's go for lunch, you can order the same fucking thing as last week. Black, long, and bourbon are sounding good, real good. I don't wanna tell you the things I think I should, but you already know. There's sweat on your brow, there's ash on the table. You're not fucking stupid, and I know that you're able. Could've done this right, but you did us wrong. Now you're sweating it out at a funeral, and I'm playing along, and nothing's fucking funny anymore. The blood of your son is in the blood of your floor. I'm big to place, but you forgot. Ooh, and I wasn't the one in danger. I wasn't the one. Nobody had to tell me what was wrong. When I got the message, he was already gone. The words on his wall tried to spell it out. But plain fucking English wasn't good enough. Can you tell me what is then? Can you tell me? Oh. Would you do it again? Would you do it again? I'm done being nice and I can't pretend we are innocent, yeah. Look me in the eye and say you don't believe me. I'll put your face to the floor if you forgot what you've seen. But it's too late now. Yeah, it's too late now. Ain't nothing's fucking funny anymore. The blood of your son is in the blood of your door. I'm big to please, what you forgot? Ooh, I wasn't the one in danger. I wasn't the one. It's too late now, yeah, it's too late now. You already know. It's too late now, yeah, it's too late now. You already know. Yeah, it's too late now, yeah, it's too late now. You already. Nothing's funny anymore. The blood of your son is in the blood of your floor. I'm big to please, but you forgot. I wasn't the one in danger. I wasn't the one, and nothing's fucking funny anymore. Something to please, but you forgot. Ooh, and I wasn't the one in danger. Wasn't the one. It's too late now. You already. It's too late now. Yeah, it's too late now. You already. So yeah, don't be afraid to reach out, kids. Here we go. All right, kids. You know the drill. You wear your mask and put it on your face. There we go. Nose and chin. We need a nursery rhyme for that. Wear your mask. Wash your hands with a hand sanitizer. Oh no, but I do have. Look what else I hang out with. 70% isopropyl alcohol. That's useful for multiple reasons. Wear your mask. Wash your hands. The system. I love you. Signing off. Make sure you hit like, subscribe, and I also dropped a little bit of $ links if you enjoyed the content, learned something valuable. I do like to provide valuable information, and yeah, see you next week.